let's begin, yeah? And any question if you've got, meanwhile, just keep putting in the chat box because I have opened chat box in front of me. So I'll be answering whenever I see that question, or else we can take the questions in the end as well, right? So it's a brief introduction of PLAB2 I'm going to do. And from November 2024, they have made little changes in the marking criteria as well for PLAB2. That is also I'm going to discuss, yeah? And those who have not joined any of our group, please join the WhatsApp group. You can see this QR code that will be helpful. I mean, the later on communication and any discount coupons and all, how you can get it and all will be, the information will be shared there. And yes, please join our YouTube channel and Instagram. Instagram, Dr.Ankurgar, please join because we do share small clips there. That might be quite helpful. And YouTube, we have got all the videos actually. Examination videos, for example. So that will be quite helpful as well. Yeah. So let's begin. Yeah. When taking the history during PLAB2 exam, will there be paper to write anything or we just have to talk? Good question, doctor. You will not be given pen and paper. No, no pen and paper. There are only 1 or 2 stations where you might get pen and paper. For example, mini mental state examination and all, because you have to score the patient. So they'll give you the paper in those stations. But in most of the stations, no pen paper is given. Okay, right. So let's begin, guys. UKMLA PLAB2 introduction. Yeah. So first of all, what is PLAB2? See, you have given lots of exams in your life, but I would say this exam is quite different. This is an OSCE exam. OSCE exam. What is going to happen? It is a consultation exam, right? And during the consultation, what's going to happen? You'll have 16 scenarios. Yeah, you'll have 16 different patients to see. And you will have the patients from all the departments, from medicine, from surgery, gynae, pediatrics, everything. Because this exam is FY2 based exam, meaning this exam is for junior doctors. This exam is for somebody who is in the internship, for example. Yeah. And in this exam, do not expect that you're going to have real patients because all the patients, they're actors, they're professional simulators, they're professional actors, right? But for example, if the task says the patient is 25-year-old male, so when you go in the cubicle, you'll find a young man sitting in the cubicle. If the task says you have got a patient of 70-year-old female, so when you go in the cubicle, you'll find a female patient sitting and age is around 70 years of age. So the station will make more sense, right? Of course, they're actors, but they'll make sure if it is written male, the patient is going to be male in the cubicle. Whatever the age is given outside the cubicle, the age is going to be same in the cubicle as well, right? So now what happened is you have got 16 stations, 16 scenarios, but you'll have 2 rest stations as well because 16 scenario in a row, it can be very challenging because you're talking. So what's going to happen? You'll have 2 rest stations as well. So in total, you can say you'll have 16 plus 2, 18 stations, right? And these rest stations, where I'm going to have these rest stations, are they going to be in between? Not really. So what is going to happen? You can have rest station anywhere. Some of you might be starting from the rest station itself. So what happened is when you go for your exam, they'll take your photo, they'll give you a GMC batch number as well. A batch which will have your name, your GMC number, and a number from 1 to 18. So 18 candidates are going to appear in the morning, 18 in the afternoon. That's how it works, right? So 18 in the morning, they'll get a number from 1 to 18. And they will also say, for example, number 7 and number 12, they are rest stations. So those who got number 7 and number 12, they'll be starting from the rest station itself. So this is how it works, right? And so you will have a task as well outside. What kind of task? I'll show you in my next slides. But to read that task, you'll have 1 minute and 30 seconds, right? And in the cubicle with the patient, you will get 8 minutes. So you'll have 1.5 minutes to read the task, and then you'll have got 8 minutes with the patient in the cubicle. So you can say one station is gonna take roughly 9 minutes and 30 seconds. That's what it happens. That's how it happens, right? So the exam duration is roughly 3 hours. Now my question comes is it easy for you to talk for 3 hours? It's challenging, isn't it? Talking for 3 hours is not that easy. Now if I put something else, can you talk for 3 hours with full concentration? Because this is the exam, right? So you have to talk in full concentration as well. So this is challenge, right? So that's why, before we go for actual exam, it's always advisable to go for the mocks as well, right? So that's how you can be prepared. You've seen like in the mocks, what happened is after 4, 5 station, candidates are like, oh, I'm done, I'm just tired, I can't just talk more. But obviously in the exam, you need to, yeah. So, and a lot of candidates have question like in between because it's 3 hours. Can I use the restroom? Can I have a glass of water in between? Yes, in the rest stations and all you'll have, so you can use the loo. You can, have a glass of water. You can eat some cookies and all. They'll be providing it there. You're not supposed to carry anything with you, but yes, they'll be able to help you out with these things, right? Now, what kind of consultation you'll be having? So in 16, you have got total 16. So you have the stations from history. History can be from medicine, surgery, gynae, ped, psych, and any department, right? Then you have few stations from counseling as well. You'll have few stations from ethics. Then you have got few stations from examination mannequin and examination mannequin teaching as well. Then SIMMAN will be there, prescription will be there, and they have got tele and video consultations as well. They don't have many tele video consultations, but they have one or two, I would say, right? So out of 16, you may have one or two tele consultations as well. After COVID, after pandemic, when they started the exam, they were giving lots and lots of tele or video consultation. But then now they're coming back on the track. Now they are not giving many tele consultation, just one or maximum two, right? So now, how the number of stations are divided, it is not mentioned anywhere on the website, but just with our experience, I'll tell you, I'll just give you a brief idea what actually happens. So usually they give one prescription station, they usually give one SIMMAN station. So you have got total 16, yeah? So one prescription, one SIMMAN, and roughly two examination mannequin or teaching, right? That's what happens. Now, roughly 6 stations, I would say maybe 3 and 3 from this department, this counseling and ethics. This is really, really important. Maybe 3 stations from counseling, 3 stations from ethics, right? And then history, roughly 6 stations you will get from history as well, right? So maybe 2 from medicine, 1 surgery, 1 gynae, 1 pediatrics, 1 psychiatry. That's how it works. But yes, is it mandatory that we will get a station from gynecology? Not really. Is it mandatory that we will have only 1 station from psychiatry? No, you might have 2 as well. So that's what I have just given. It's a rough idea. I mean, it's not like given anywhere on the websites. Yeah. Now, tele and video consultation, as I said, 1 to 2. And the tele and video consultations are going to be from history, most probably. And it can be from counseling and ethics as well, right? So you can have a breaking bad news, an angry patient, a demanding patient, or a smoking cessation, or a patient referral, or the patient has come for the follow-up. All these scenarios can come as a tele or video consultations as well, right? So this is how it works. So these are the types of consultations that you have got in this exam, right? Now, in this exam, what happens is you're not allowed to carry your watches, and there is no clock in the room as well. So how will you get that idea about the time? Because how much time you have got? You have got 1 minute 30 seconds outside the cubicle, and then you have got 8 minutes inside the cubicle. That's what happens, right? Right? So no watch, no clock. How am I gonna get the idea about the time? So that's quite tricky actually. So after 1 minute and 30 seconds, when you're standing outside, and once it's done, there will be a bell saying begin. The bell will ring and say begin. Begin means you go in the cubicle. When you go in the cubicle, your first interaction is going to be with the examiner. You simply introduce yourself to the examiner. Good morning or hello examiner. This is, I'm Ankur. My GMC number is this. So GMC number will be here. As I said, they will give you a badge. You just read your GMC number from there, right? And then they will be telling you that you can proceed for the station. So you'll proceed and you start talking to the patient. That's how it works. So in the cubicle, you have got 8 minutes, yeah? And there are a few things you need to cover. There is a history, there is management that I'm going to tell you. So how you get the idea how much time is left. So there is a bell system. So after 6 minutes, there will be a bell saying 2 minutes left. And then there will be another bell at complete 8 minutes saying move on to the next station. So that's how it works, right? So after 1 minute and 30 seconds, this task will say begin, you go in the cubicle. In the cubicle after 6 minutes, there will be a bell saying 2 minutes left. And then there will be a bell after complete 8 minutes, which will say move on to the next station, right? So that's how it is going to be, right? Now the regression scoring method, that's a new scoring. Now a lot of candidates, they're like, is it good or bad for us? I would say it's actually better, actually good. So what used to happen, let me tell you. So the previous passing score, previous marking criteria. So there used to be two ways. So there will be two criteria that you are supposed to fulfill. Number one, you need to get above the average score. And number two is you need to pass 10 out of 16 station. That was the old marking criteria. Get above the average score and you need to pass 10 out of 16 station. Get above the average score. What I mean by that, let me go into it. So, what happened is, see, every station is divided into three headings. Every station, they'll be marking you for data gathering. They'll be marking you for clinical management. They will be marking you for your IPS, your interpersonal skills as well. So every single station will be marked under three headings: data gathering, management, and IPS, interpersonal skills. And maximum score is 4. For management, maximum score is 4. For interpersonal, maximum score is 4. So in total, what's happening? The one station is of 12 marks. One station is of 12 marks, right? So how many stations we have got? How many stations we have got? We have got 16 station into 12. Yeah. Now anybody who is good in maths, what's the total score? What's the total score? Anybody good in maths? Tell me. 16 into 12. So that is the total score. How much? How much? How much? So 192, because we have got 16 station, 2 are rest station, right? 2 are rest station. So that is definitely not be marked, right? So 16 into 12, 192 is the total score. You need to get above the average score. What's going to be the average score? It is going to be different on different days. It is going to be different for different station as well. Right. So for station number, like one station of counseling, the passing score is 5. There is another station on ethics, the passing score might be 7 as well. So every station will have different passing score. And that's how it works. So but roughly what we have seen is 6 to 8 is the passing score. Some station 6, some station 7, some station 8. But we have seen some station 9 as well. You've seen some station 4 and 5 as well, right? So anything can happen. But roughly 6 to 8, that's the passing score. So what you need to do, you need to get above the average score. So in total, what do you think? So I would say if you get somehow 110 plus minus 5, you will be most probably passing this exam, roughly. Same in PLAB1 as well. If you see, if you are, I mean, the total score is 180, and if you get roughly 120, you'll pass the exam roughly. I think the last time, this time, the passing score was 117, if I'm not wrong. Or tell me in the chat box, what was the passing score this time for PLAB1? Because you just got the PLAB1. It was 115. Okay. Last time it was 117. So last time when I spoke to the candidates was 117. So this time 115. Okay. So that's how it is. I mean, so it's going to be different for different exam, isn't it? Different dates. Same for PLAB2 as well, right? So they're supposed to get say 115, 120. That's kind of a very safe score in the exam, right? Now, initially they used to say you need to pass 10 stations as well. You need to pass 10 stations as well out of 16. So what we saw previously, I'm not talking about today's method. Previously, what used to happen, there were a lot of candidates, they got above the average score, but they didn't pass 10 station. They passed only 9. So they had to repeat the exam. There were many candidates, those who passed 11 station, but they couldn't get above the average score, so they had to repeat the exam. So you had to fulfill these two criteria. But now, what they have done, they have removed this criteria of 10 stations. They have removed this criteria. How many stations you are supposed to pass that particular exam? It is going to be decided on that particular day. It might be 9, it might be 10. Can it be 11 as well? Yes, yes, yes. But it is less likely to be 11, right? And so what happened is, what is changing from November 2024, this year only, the minimum 10 station to pass will no longer apply. Each exam will have a unique pass requirement that is calculated by this method. How does it work? It calculates the pass mark based on the exam difficulty. So what used to happen, there were a few days in the exam, mostly candidates, they failed the exam because the exam was very tough and they were very it was very difficult for them to pass 10 stations. So do you think it's fair? It's not. So that is why, because a lot of people are emailing that it's not fair, the exam was tough maybe on that day. So that is why they come up with this idea. Now the 10 station you have to pass. No, it's not longer in the picture. It ensures that consistent challenge levels between the exams, right? Because one day exam is difficult, one day exam is easy. So we have to use this method. So when the exam is difficult, the passing score should be a bit less, so that we can have equal and no, I would say no racism in the marking, isn't it? What does it mean? It is improved fairness and consistency, and candidates won't know exact pass requirement beforehand. So you don't know, are you supposed to pass 8, 9, 10? You don't know that. And results will automatically reflect the new scoring logic. So you'll see you have got above the average score and you might have passed only 9 stations, still you managed to pass the exam. Is it good? It's very good, isn't it? It's very good. So I would say the regression scoring, it is gonna be much, much better, right? So, but those who will sit after the new scoring, there has been no minimum station. Only their pass score and average score has been mentioned. Only their pass score and average score. No minimum. Yes, yes. So when you get the result, there will not be mentioned of minimum stations you need to pass. They will not mention that. Right. So it will be decided and it will automatically reflect. For example, you pass 9 stations, still you managed to pass the exam. It means you passed more than the required number on that particular day. That's it. So they won't make it very clear on that particular day how many stations were required to pass. No, they will tell you they will tell you the average score required to pass. And if you got above it or not, because you have to get above it only, right? But they won't tell you how many stations were needed to pass that particular day. Right. So that is something that's going to happen. And also, guys, the good thing is, in the last few results, because those who gave the exam in late November and all, they got the result already, and it was much better. I mean, for some time, it was even 9 stations and they managed to pass the exam. So it is more or less like PLAB1 scoring only. And also, what they do actually, they do their mock exams as well with their FY2s. Every 3 to 6 months, they call their FY2s and they run a mock exam as well with them, with some new scenarios and all. And once that mock exam is done, then they'll see how they perform their FY2s. And then they will give those stations to us. So it is easy for them to have a standardized thing, because when their FY2s, they appeared for the exam, so they know how they perform, how much they knew about that station. So obviously they don't expect more than that. They expect something similar from us as well. So that's how it is done, right? So moral of the story, this method is good or bad? I would say it's much better than the previous one, and the chances of passing the exam, it will definitely improve a bit after this regression method of scoring, right? So that's much better, I would say. I don't need to worry about it. Like it is new, is it something bad for us? No, it's something very good for you guys. Yeah. Okay. Now what happened is, when you get the result, this is what happens. You will, so data gathering, management, interpersonal skills. So they'll give you the sheet like this. So they will tell you, like in station number 1, the name of the station will be given. So they'll tell you how much you got for data gathering, how much you got for clinical management, how much you got for IPS. And they will tell you this is total score you got. Now the pass score needed. Now if you see, it is in the decimals. It is in the decimals. But nowadays, when you're getting the pass score needed, they're not giving it in decimal. They are just make 7.98, they'll make it 8. 7.15, they'll say it's 7. 8.1, it's 8. So nowadays, they might not be giving you the things in decimals. They will just give you a whole number. What was the pass score needed to pass that particular station, right? So station number 2, the name will be given, and they'll say data gathering 3 marks, management 2 marks, IPS 4 marks. Total you got 9, and the pass score needed is 7, so you pass that station. So this is how it's going to be for each station. All 16 stations will be given in this way. The name of the station will be given, and they'll tell you how much you got for each domain. They'll tell you whether you failed or passed that station, right? Now, initially we used to have 10 stations to pass, but now that is not there anymore. So there they will check what was the pass score needed to pass, so say 133, and how much you got? 134. So that is good. And on that particular day, they will decide how many stations were supposed to be cleared for that particular day. And accordingly, they'll decide whether you failed the exam or you passed the exam, right? So they'll give you a detailed result. So that's one. Another sheet, when you get the result, you get two sheets. This is one of it, and this is the second one. So they are checking you on 10 skill areas. They're checking you on 10 skill areas. What are these 10 skill areas? Let's go a bit more in detailing of it. Yeah. So they are marking you on consultation, they're marking you on diagnosis, examination, finding issues, language, listening, management, rapport, and time, right? So they're marking us on these 10 skill areas. So in every station, they're checking how's our consultation skills, if we're able to make the diagnosis, how was our examination, findings, issues, all those things. So if you see, there are some ticks as well. Nowadays, sometimes they write the word you as well. So for example, station number one, if you see there is a tick in consultation, there is a tick in listening as well. What does it mean? There's nothing to be proud of with these ticks. It means something opposite. So if it says a tick in consultation listening, it means for station number one, my consultation skills were not up to the mark and my listening was not up to the mark. That is the thing. So nowadays, that's why they write the word you as well. You means unsatisfactory. So you should be happy if the sheet is clean and clear. But if they've got many ticks and all, it is gonna be tricky, right? It's gonna be tricky. So try making sure you don't have any ticks. Now, before we go into any exam, we should understand the results, how they give you the result. What are the results based on? So the result is based on these 10 skill areas. So I'm going to discuss this next slide, which actually going to tell you in more detail. For example, consultation, what they want from you in consultation, what they want from you in issues. So that will be very clear after this slide. And I've taken this slide from GMC only, right? Everything, all the reference from the GMC website and ICKS guidelines only, right? Tick means unsatisfactory. Yes, don't be happy. Why got tick? Because what we think tick, it means I did something good, isn't it? But it is not like that. So tick means, so if I ask you station number 15, what are the things I didn't do correctly? It means examination was not done correctly. Findings, you were not able to find the proper findings. Your listening skills were not good. That is what it means. Yeah. Now, the feedback statement. So this is a positive that you should be doing. This is negative. This you should not be doing. Yeah. So consultation, smooth consultation, unstructured consultation, illogical, disordered approach, a big negative. Smooth consultation. What do you understand by a smooth consultation? See, any consultation you're doing, there's a pattern of it. For example, you're having a medical case, medicine history. A patient has got, say, abdominal pain or chest pain or shortness of breath. So what you're supposed to do in the beginning, you do elaborate the presenting complaint, yeah? You ask associated symptom to confirm your diagnosis, and then you ask for some differentials, some important emergency killer differentials you rule out. Then you've got your past medical history, you've got your lifestyle history, your social history, and then examination management. So that's how it's gonna be. Yeah, that's how it's gonna be. So if you're jumping from one part of the station to other part, they may not like it, and they might give a tick in consultation. So stick to the consultation, right? Now some candidate says, do we need to really stick to this consultation? But if needed, can I ask some question a bit here and there as well? If it is making sense, yes, you can. Let me give an example. I got a patient. Patient is having, my patient is a young female patient, and patient is having vaginal discharge. So vaginal discharge, I'll elaborate on the vaginal discharge. I'll ask some associated symptoms as well. For example, like tummy pain, nausea, vomiting, fever. I'll ask all those questions as well. Now, my most probable differential diagnosis is STI. I will not be able to confirm my diagnosis of STI until unless I ask sexual history. Usually, sexual history we ask in the later part of the station. When it is like in the personal history, in the later part. I'll show you in the today's webinar. So should I wait till the end to personal history, then only ask about sexual history, or can I ask in the beginning as well? Can I ask it in the beginning as well? That is the question. The answer is yes, you can ask. Can I ask somewhere in the beginning, in the first 2 minutes, rather than waiting till the end? Yes, you can ask because it is logical to ask. So it is not a big deal, right? Try to stick with the consultation, but yes, you can go a bit up and down if it is logical. That is the main thing. Yeah. Number two, issues. Recognize the issue. So now a lot of candidates they ask us, should I do medical management first in a patient or should I go for non-medical management? Tell me, medical management first or non-medical management first? Can you please give guidance for the candidates who will be giving PLAB2 and joining as FY1? We'll discuss that. We'll discuss that. So tell me. Medical management first, non-medical management first, guys. So I got answers mixed. Non-medical, medical, non-medical, non-medical, medical. Okay, my answer would be it depends on the patient. It depends on the patient. You cannot generalize it. It depends. I don't know what kind of case I'm having. So what it says, giving health and lifestyle advices to an acutely ill patient doesn't make any sense. Your patient is having acute exacerbation of asthma, patient saturation is 80. And what you're saying? Do not smoke, John. Don't drink alcohol, John. Come on, it doesn't make any sense. An examiner will be pissed off, isn't it? So this is what you need to do. The some station may be medical because patient is struggling to breathe, so you need to go for oxygen, isn't it? So you go for medical approach first. But on the other hand, you got a scenario where a patient is just diagnosed with diabetes or high blood pressure. So what you will do? You go for lifestyle management first. If needed, maybe medicine. So, medical first or non-medical first? I don't know. I'll see the patient. I'll decide. I'm a doctor, isn't it? So that is what you do. Yep. Third, time management. This is the biggest problem actually. Time management. Now, a lot of candidates, they're like, come on, I'm seeing a patient, so I should have unlimited time, isn't it? No, that's not going to happen. Even in real life, doctors, when you're going to the GP, I'm not sure, maybe some of you are registered with the GP already if you're staying in this country. GP, they have got a limited time for you. They give only 10 minutes to you. In those 10 minutes, they'll take your history, they'll examine you, they'll give you the prescription, they'll do everything. So they're training us from today itself. That's why the consultation in the exam is kind of time bound, right? So time bound. So you will have only 8 minutes. Yeah. Now, I've got 3 domains to do. I've got data gathering, I've got management, I've got IPS, interpersonal skills. Interpersonal skills is how you talk, how you make your patient more comfortable. I'll discuss about it in the later part of today's webinar. So history taking, data gathering, and management. How much time for history? How much time for management? That is the question. So I've seen a lot of candidates, what they do, there will be a bell after 6 minutes, yeah, which says 2 minutes left. I've seen a lot of candidates, what they do, they take history for 6 minutes and then they give the management in the last 2 minutes. Is it a good idea? Is it a good idea? The answer is it is a really bad idea. Because see, data gathering, how many marks? 4. Management, how many marks? 4. How can you just give the 2 minutes to the management and expecting 4 marks? It's not going to work. So you should give equal time. 4 minutes to your data gathering, 4 minutes to your management. Obviously, when I'm talking to the patient, I don't know when it's going to be 4 minutes. So you need to train it that way. So when you practice with the timer. So you'll get an idea, okay, now it's 4.5 minutes. I should be starting my management as soon as possible. I know sometimes patient is talking too much, giving more information, so it might take a bit longer to take history. But again, don't go beyond 4.5 minutes. If you are going beyond 5 minutes, I would say you will not get good marks in that station. So you have to be very, very careful in that. Time management is very crucial. You do not have to ask every single question. I'll give you all the questions, but then I'll tell you, you don't need to ask every question. Because if you ask every question, then what is the difference between you and a non-medical person? Because if there's a list and you're asking all the questions from the list, then they don't need a doctor. They can have a machine who can ask all the questions. But as a doctor, I know I got this patient who's having chest problems. I know what lifestyle questions are important. I know this patient is having abdominal liver related problem. I know alcohol is important. I know this patient might be having lung cancer. I know smoking is important. I know occupation is important. So what to ask, what to miss? Who's a good doctor? Who asks less question and who gives less medication? That's what you need to do. Yeah. But obviously not missing the red flags. Findings. So identify the normal findings or results. Yeah, so obviously they will give you some findings in history, some findings in examinations, some findings in investigations. So make sure you're able to interpret it properly. Yeah, diagnosis. Sorry, examination. Proper examination, use the instruments proficiently. So in many stations, you will see they will be given some instruments as well, like they have got fundoscopy, they have got otoscopy. Do you know how to hold the ophthalmoscope? Do you know how to hold otoscope? Right. So do you know how to hold speculum? So these are the things they are checking, right? So we should be very carefully manage these stations in the exam, right? That's your examination. Now diagnosis. Now tell me, guys, what do you think? Will you be able to make the diagnosis in all the stations? And when you're sitting in your clinic, are you able to make the diagnosis for all your patients? Yes or no? Are you able to make the diagnosis for all the patients when you're sitting in your clinic? And do you expect that you will get every single diagnosis in the exam? 16 station, will you be able to get all the diagnosis? Maybe yes, maybe no. So if you don't get the diagnosis, what you do in your country? If you don't get the diagnosis, very clear diagnosis from the history, what do you do? What do you do? Can I say you will have some differentials in your mind? You don't know this is this, but you know it might be this, might be this, might be this. So what you do? You do investigation. Yeah, you do investigate accordingly. Like I would like to do this, I would like to do this, and once I have the report, then the diagnosis is gonna be more clear in front of me. That's what you do. So please do something similar here as well. See, in the cubicle, when you're in the cubicle, if you can somehow show it to them that I'm a doctor, you will pass the exam, right? You'll pass the exam. But if you are still showing I'm a medical student, you may not pass the station, right? So do we pass the station if we don't get the diagnosis? Yes, 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 you can still pass the station. But see, you have to be very careful. For example, I'm giving you a history of cough, shortness of breath, fever. You understood I've got chest infection, but you're not very sure, do I have got pneumonia? If I've got ECP pneumocystic pneumonia, or I've got tuberculosis, you're not very sure, but you understood I've got infection. So what you will say in the management that Jacob, I've taken your history and it looks like you might be having some infection, right? Which infection? I'm not very sure because I've got few things going on in my mind. But you mentioned you have cough, I'll give you something for your cough, I'll give you something for your fever as well. But I need to investigate it further to make sure what's happening with you so I can treat you accordingly. So what I'm going to do, I'll be doing some routine blood test for you. I'll take the phlegm sample, we'll send it for investigation. I'll consider doing a chest x-ray as well. Once I've got the report, I'll be in a better position to tell you what's happening. And I also am going to call my senior as well. They'll also come and have a chat with you. Right? So this is something that you should be doing, right? I know the wrong diagnosis passes you because it narrows you down to the wrong LA. Instead, use differential diagnosis, go home. Yes. So I won't recommend you to just to give one of the diagnoses. It might be wrong. So that's not a good idea. So give the possibility that it might be this, it might be this. Why I'm saying it could be this? Because this is your history. You gave me this history as well. So this could be your diagnosis as well. So I'm not very sure. But I'm going to give you symptomatic treatment and I'm going to investigate you and then I'll be sure what's happening. Right? This is absolutely okay and you'll get very good score if you go this way. Right? But you know, some candidates, what they do, they go very generic. That is not good. For example, one day we were doing a station and candidate said in the management, he was not very sure what's the diagnosis, which is fine. But he said, you have got something, okay, I'll do something and I will give you some medications and I'll call my senior, they'll come and have a chat with you. Do you think this management is important or is it enough? No. I have something I know, that's why I'm here. You will do some investigation. Which one? You will give me some medication. Which one? You need to be a bit more specific. I'm not saying that you tell me which medication you're going to give me for my cough, which medication you're going to give me for my pain. No, I'm not expecting that. I'm just simply expecting I'll give you something for your cough. I'll give you something for your fever. I'll give you something for your pain. Just mention that. And I'll be doing the investigation. Which investigation? Chest x-ray, blood test, and a blood test. You will get very good score, doctors. Right? So it's not like always you have to give the diagnosis. Sometimes you can play with the differentials as well and give the plan of management. Management is not just giving the diagnosis. Management is how I'm going to manage you overall. That is the management. Yeah. So this is very, very important. Management. Now GMC says one thing. Proper management plan must include follow-up and warning sign. Right? So management is just not giving the management like medical treatment or medical. No. You have to tell the patient about the follow-up as well. You need to tell the patient what to look for in an emergency. So the warning signs, the red flags as well. So that's what you don't need to do. So that is what you call as proper management. Yeah. Repo. Make your patient comfortable. How are you going to make your patient comfortable? How are you going to make your patient comfortable? Any example? If you want to say, tell him in the chat box, how are you going to make your patient comfortable? So there are many ways you can do it. Yeah. How to make your patient comfortable? Reassure the patient. Yes. If it's a reassurance station, reassure. Listening to the patient. Very, very important. I'll be very bluntly saying most of us, we do not listen to our patient in our countries. And there are many reasons. One reason is you have to see so many patients in an hour, so you don't have that much of time. But here you're getting 8 minutes. So in real life, in the GP, you're getting 10 minutes. So make sure you listen to the patient. Listen, listen, listen. Don't talk much. Listen. That is what this exam is all about. If your patient is talking too much, you'll get a very good score. And if he's not talking, you make him talk, then only you'll get marks. That is the thing. Yeah. Address their concern, very important. Being sensitive towards their concern, that's important. Allow time to the patient to open up, very important. Like you may have a case on abuse, domestic violence, sexual assault. So what's going to happen? These patients, they'll take some time. They'll take some time to open up. And you need to give them time. Don't bombard them with the question, one question, second, third, fourth. Don't do that. Give them time. Build the rapport and then encourage them to talk, right? Reassure, I'm here to help. Then only they'll open up. Yeah. Address their expectation. Very important. Sometimes what happened, you got a case, you did the management and you thought like, I did everything in that station. No, but you may not have met their expectations. You may not get good marks in that. I'll give a very good example in the later part of this webinar for this expectation thing, right? So a lot of things that you can do to build the rapport. Yeah. Next, listening. Pick verbal and non-verbal cues. See, listening is not just listening. You need to pick verbal and non-verbal cues. Verbal. I say, doctor, I'm in pain. Doctor, I've got cough. That's my verbal cue that I'm having this problem. Let's solve it. That's simple thing. But in the exam, you will see there are lots of non-verbal cues as well from their side. For example, patient is talking to you and shaking his leg. So it is something important, and you need to acknowledge it. Many times what happened, you have seen that patient is shaking his leg, but you have not commented on it. So if you have not commented, you will not get marks for it. So you need to pick non-verbal cues as well. Simply saying, Jacob, I can see you're shaking your leg. Is everything all right? Do you want me to do something for you so that you feel more comfortable? So this is something that you need to do, right? This is really important. Yeah. So pick verbal and non-verbal cue. If you see anything unusual in the station, what you will do, you will acknowledge it. Yeah. What if time is up before taking essential history? If patient is talking too much, see, when patient is talking too much, they are giving you the whole history. They're not there to waste your time. They're actually giving you everything in one go. Just listen to them carefully and then you will realize they have told me everything. I don't need to ask much of them, then start the management as soon as possible, right? So don't need to worry because it is scripted. This exam is scripted. All the patients, they're going to get their script and they do stick to it. So don't worry about it. And another thing, doctor, if, for example, you did struggle in that station, trust me, it is not only you, everybody else is going to struggle. I'll give an example. Whenever I do domestic violence case in the class and we practice that station, I've seen candidates struggle with time. And they're like, how can I manage it? See, I know that particular candidate want to do 10 things in the management, which I told them, like, this is the management, these are 10 points of management in domestic violence case. But when they started the management, because I opened up late, so they didn't have enough time for the management. They've got only 1 minute left. They can't mention all 10 points. What they can mention, only 3 or 4 points. So how I'm going to get full marks? You can still get it. So what you need to do, you are mentioning 4 points now. Which 4 points out of these 10? What do you think which point is the most important point? And if you're able to find that, you'll get full marks. And if you are struggling with time, trust me, the friends are also struggling. It's not only you. So in the end, what's going to happen? That is how the marking will be done. So you don't need to worry about it. Yeah. So if they're talking too much, it is actually helpful for you. And I would like them to talk more. So they give me the history quickly, so I don't struggle and asking them too many questions. Yeah, that's better. Language. Please use the language or explanation that are relevant and understandable to the patient. Please do not use medical jargons. However, if you're talking to the doctors, if you're talking to your colleague, you're talking to the nursing staff, maybe in the cubicle, in that particular station, then okay, you can use the medical words. But if you're talking to a patient, what you do, please use patient-friendly language. To be honest, when you have to give the management to the examiner, it's easy. I would say it's easy because you can use medical words, you can talk fast, no problem at all. But if you are giving the management to your patient, it becomes really difficult sometimes because you have to modify the words, you have to speak in very simple language, you have to slow down as well. You need to check the understanding of the other person. Are you with me? Are you following me? Do you want me to repeat anything? So you need to do lots and lots and lots of things. Yeah. So these 10 feedback statements are really important. So that's how they mark you in your exam. Yeah. Now, this is a sample task. So how the task is going to be in the exam, right? So this is a sample task, and also this task, the same task will be there in the cubicle as well, right? The same task will be there in the cubicle as well. So if you would like to see that task again, that shouldn't be a problem. Yeah. So the paper is outside the cubicle and the same paper is inside the cubicle as well. So you will read the task, we have 1.5 minutes, and then you'll go in the cubicle. In the cubicle, if you feel like, oh, I missed some point, can I see it again? Of course, you can see that again as well. Yeah. Just a second. Yes, let's come back. I'm really sorry. Okay, so sample task. So what I was talking about the sample task, that you'll have this paper outside the cubicle. You'll have this paper outside the cubicle and the same paper is going to be inside the cubicle as well, right? So if you would like to see the task again, can I do that? Of course, you can do that. There is no problem in it. Yeah. Now let's have a look what actually they give us in these sample tasks. So first is your foundation year 2 doctor in rheumatology unit. Yeah. So every single task will be divided into 5 headings. Number 1, where you are. Number 2, who the patient is. Number 3, other information you have about the patient. Number 4, what you must do. And number 5, special note. Right. So this is what is gonna happen. So every particular task, this is important. All the 5 points, where you are, who the patient is, other information, what you must do, special note. Everything is important. Why? Let's have a look. So where you are foundation year 2 doctor, FY2 doctor in rheumatology unit. Is it important for me to know where I am? Am I in the rheumatology unit? I'm in the A&E, I'm in the GP. Is it important? Yes, it is very important. In every single station, you will be an FY2 intern. How many of you tell me if we have got any specialist doctor in the webinar? Tell me in the chat box if you've got any specialist, any physician, any surgeon, any gynecologist, pediatrician, psychiatrist. Tell me in the chat box. Because in the exam, what's going to happen? You will be an FY2 doctor, right? So the problem is those who are specialists, they may find it a bit tricky. So we have got one pediatrician. So doctor, I would say be very, very careful if you get a station on pediatrics in your exam. What happened is you know too much in pediatrics. So you got a station, say for example, febrile convulsion. You know everything about febrile convulsion. You know much better than everybody amongst us, right? Because you are a specialist in it. So what happened in that? You try telling lots of things to the patients and you don't let the other person talk in the exam. And I've seen a specialist failing their station. I've seen specialists failing their station, which is I mean, not good, isn't it? So you have to be very, very, very careful on that. Yeah, so just be very careful on this part. So, for example, your foundation 2 doctor in the GP. So, can you admit the patient in the GP? No. So, that is why it's important. I'll give another example. A patient has taken, say, 40 paracetamol tablets. Patient has taken 40 paracetamol tablets. And the task says you are FY2 in the A&E. You are in the A&E. So somebody has taken 40 paracetamol tablets. Patient is in the A&E. What are you going to do? What kind of history are you going to ask? I would say you'll ask medical history questions. Medical history, like you'll ask which tablets, when did you take it? Did you take it in one go? Did you take it with water? Did you take it with something else? So these are the possible questions that you're going to ask, right? Are you interested in asking why did you take the tablet? I would say no, I'm not interested at the moment because I'm in the A&E. My patient has taken 40 paracetamol tablets. What is my aim? My aim is to save the life of the patient. That is the main thing. So I'll be taking more of medical history. I'm not much interested in psychiatric history here. On the other hand, if there's 40 paracetamol tablets and patient has been medically managed and the task says you are in psychiatry, now what kind of questions you're going to ask? You'll ask psychiatry related question. Why did you take these tablets? Did you try committing suicide before? Any plan to do it again? What you were thinking? Who got you there to the hospital? Who was there with you? So all those psychiatric related questions you need to ask. So where you are in the A&E, you are in psychiatry, you are in the GP, the history that you will take will be very much different, right? So you have to be very, very careful about this point where you are. Second, who the patient is. Stanley Smith, age 45, has been referred by the GP because of pain in the right big toe. So what they will tell you, they'll tell you briefly about the presenting complaint of the patient. They'll tell you the name and age of the patient as well. So this is what they do, right? So patient referred by the GP because of the pain in the right big toe. Nowadays, you might see some of the station which says that patient has been referred by the GP because of some problem. Which problem you don't know, so you need to go and find it out. But otherwise, patient has been referred because of the pain in the right big toe. So tell me, pain in the right big toe, what comes in your mind? Pain in the right big toe, what comes in your mind? What do you think can be the diagnosis or differential here? Pain in the right big toe. Yes, can I say it looks like it might be a gout? Yeah, okay. So they might give you some extra information as well, other information about the patients. They might say none, they don't want to give you any extra information. But they might say other information that patient is fond of eating steaks. Patient is fond of drinking beer. Patient is hypertensive and taking thiazides. What is the meaning of all these things? Patient is eating red meat, steaks, that is a risk factor. Drinking beer is a risk factor for gout, and taking thiazide is a risk factor for gout. So they might be giving some extra information, but sometimes what they just say none, right? What you must do, that's your task. Talk to the patient, assess him. Whenever they say the word assess means what? Assess means history and examination. Assess means history and examination. That's the main thing, right? So you need to do history, you need to do the examination as well. And discuss the management with the patient or with the examiner. They will be asking you only one of it. And 99% of the times, it is going to be with the patient. The management is going to be with the patient. When you discuss it with the patient, you need to be very careful with the language as well. So read the task, what you're supposed to do. Assess means history, then you will do the brief examination as well. Sometimes you don't need to do the examination. You just mention, I would like to do this examination, and the examiner might give you the findings as well. But sometimes you're supposed to do the examination as well. Now you might be thinking, how do I know whether I'm doing it or just mentioning it? So when you enter into the cubicle, you just need to look at the room. Did they give me anything for the examination? Did they give me a hammer? The patient is lying on the couch. Patient is wearing shorts. Patient is, and they have given you a thermoscope. There is a fundoscopy mannequin. What does it mean? They want you to do the examination, right? So you will get the hints when you enter into the cubicle. And please check the discussion, the management is with the patient or with the exam. Right now, there is a special note as well. So, patient is worried, patient is angry. So they might be giving these special notes as well. Yeah, so this is what happens. Another thing, you need to very carefully see that are you talking to the patient or you're talking to somebody else? So this is really important. Are you talking to the patient or you are talking to somebody else? Uh, so if you are talking to somebody else, the consent is the big thing. Consent is the big thing, right? So you have to see if the consent was taken from the patient or not, because if there is no consent from the patient, you cannot give any information to the relatives. That's really important. In most of our countries, what happens if the patient is diagnosed with something big, something like say cancer or so, what we do? I mean, you can do like you can still discuss the things with the patient's relatives, isn't it? That's okay. But in this country, you cannot. You have to have consent from the patient. However, if the patient is confused, patient is unconscious, definitely you can't take consent. That's a different thing. But if patient is competent, you cannot discuss anything with anybody unless you've got the consent from the patient. So if you're talking to third person, you need to see that patient, not that consent has been taken from this patient to talk to the relatives. So this is very important. So this is how the task is going to be. Every single task will be divided into these 5 headings. You have 8 minutes to complete the station. Yeah. So this is a sample task. Paper is going to be in the cubicle as well. Yeah. Now, how are you going to start your history? So always, greet with a smiley face. Now people say, should I laugh? See, there's a difference between smiling and laughing. I'm not laughing on the patient problem or patient symptom, but I have a smiley face. So when I go in the cubicle, my patient feel, yeah, this doctor looks very confident. That's the meaning. So greet them with a smiley face. Hello. A lot of people say hi as well. Hi is not wrong, but hello is more professional. That's what I say. Yeah. Introduce yourself and identify the patient details. That's really important. Yeah. Hello, I'm Ankur, one of the doctors here. Can I get your name and age, please? They'll tell you, yes, I'm Jacob Smith and my age is 45. All right. And then you will start the station. Yeah. Now, can I use the name given to me in the question? Because as I said, the name of the patient will be given to you in the question. Can I use that? Yes. Hello, I'm Ankur one of the doctors. Are you Mr. Stanley Smith? Yes, doctor. Could you please confirm your age for me? I'm 45. Great. Tell me, what brings you to the hospital? Tell me, how can I help you? So it is entirely up to you how you want to start. It is entirely up to you how you want to start. That is it, right? So this is what happens. Yeah. So you can use the information given to you in the question, or you can confirm it once more. That is absolutely, absolutely fine. Can I use good morning, good afternoon? Yes, you can do that as well. But then your exam is starting at 11. For example, you're in the afternoon. Should I say good morning or good afternoon? I'd say go with hello. That is much better. But yes, I can definitely say good morning, good afternoon. There's nothing wrong in that. Yeah. Now, history taking, what you do? What we have is the presenting complaint, then you elaborate the presenting complaint, then you have got some associated symptoms to confirm the diagnosis, then you have some differentials, then past personal social history. That's what we usually do. Yeah. Let me go with this a bit more in detail. Can I use Mr., Mrs. prefixes? If it is given in the question, yes. Otherwise, I have to be very careful, right? If it is given like Mr. Stanley Smith, you can use it. But please don't say sir and madam. We do not have the culture of saying sir, madam in this country. We usually address them with the name. For example, if it is Mr. Stanley Smith, I'll say Stanley or I'll say Mr. Smith. Or you can ask the patient, how would you like me to address you? So that's what you can do, right? But no sir, madam, but yes, prefixes can be used with the surname. My name is Ankur Garg. I'm Ankur or Dr. Garg or Mr. Garg. That's it. So Stanley Smith. I'm Stanley or Mr. Smith. That's how we go about it. Yeah. So history taking. So I've got the presenting complaint. You elaborate the presenting complaint, whatever it is. It was cough and whatever. So you elaborate about the pain. You elaborate about the cough. Then you ask associated symptoms. So first question that you'll ask is, how can I help you? Patient said, I'm in pain. So what you will do, you ask open question. Tell me more about pain. Tell me more about pain. Yeah, this is what you do. Don't ask where is the pain, what kind of pain, what is the scoring of this pain. Don't do that. Always go with the open questionnaire first. An open questionnaire, you give the time to the patient to talk. You are encouraging the patient to talk, right? Doctor, I'm in pain. I'm in pain. Okay. I'm really sorry to hear about your pain. Could you please tell me a bit more about your pain? You can also ask, are you comfortable to talk, right? And then ask more about pain. So what's going to happen? First of all, see, presenting complaint could be pain. So if there is pain, you need to elaborate. How you elaborate? By doing Socrates. Site, onset, character, radiation, associated symptoms, time, exacerbating and relieving factors, and the severity of the problem. Severity of the pain on a scale of 1 to 10. So that's how you elaborate the Socrates. If you've got cough, shortness of breath, how can you elaborate? You can elaborate on by using ODPARA, onset, duration, intensity, progression, associated symptoms, relieving and exacerbating factors, right? So that's how you can do that. If it is cough, you can also ask if it is dry or productive. If it is productive, what is the color of the phlegm? If there is any blood in the phlegm or not. So these are the questions that you can ask. If the presenting complaint is fits, fall, loss of consciousness, dizziness, vertigo, so you'll take history by using before, during, after, right? So I'm not going into detailing of it because that is going to take more time, right? That we will be doing when you will attend the full course and all. So what I mean to say is, presenting complaint, you elaborate the presenting complaint first by asking open question. You simply ask, tell me more about pain. So patient will tell you a lot of things from Socrates. They might tell you the site, they might tell you the onset, they might tell you the character, they might tell you the time as well. But they didn't tell you the radiation, they didn't tell you the severity. So what's going to happen? You can elaborate those things by asking closed question. First, always open question. What you got good, what you didn't get, can ask closed question and finish it off. Once you are done with the elaboration of that presenting complaint, you need to ask next question. Next question would be again an open question, which would be anything else? Anything else? Patient might say, doctor, with pain, I've got cough as well. What will be your question? Tell me more about cough. So you got pain, you got cough, elaborate it. So what's going to happen based on the pain, based on the cough, you will have few differentials in your mind. So you'll ask some associated symptoms to confirm your diagnosis, and you rule out some important killer differentials as well. My question is, how many differentials I should be ruling out? How many differentials, guys? How many differentials? When you rule out the differential, you need to rule out the red flag, emergency, killer differentials. And I would say maybe two, three, it should be okay. But when you are elaborating the presenting complaint, you will see you have ruled out so many differentials already. You have ruled out so many differentials already. Let me give an example. We have got a young female patient having pain in the this area, right iliac fossa. We have got a female patient having pain in the right iliac fossa. Give me the differentials. So female, say 27-year-old, female, pain in right iliac fossa. Give me the differentials, guys. PID, somebody said. Okay. Ovarian torsion. Okay. What else? Appendicitis, somebody said. Somebody said ectopic. Somebody said kidney stone. More. Any more? Pelvic abscess, UTI. Okay. Crohn's. Fine. Okay. I'll take that as well. I think that's enough. That's the common ones here. I think we are good. Now, let's do one thing. Let's elaborate the presenting complaint. So patient said, doctor, I've got pain in the right iliac fossa. And my question to the patient would be, could you please tell me a bit more about your pain? And this patient elaborated the pain, and I asked the question for Socrates as well. And this patient said, doctor, I've got pain in this area, right iliac fossa. I just pointed towards that. It is a dull pain. It is 5 out of 10. And there is no radiation and no shifting of pain. And it started yesterday, and intensity is not getting is the same, nothing is getting worse, and 5 out of 10. So that is the history. Now, with this history, now let's come back to our differential, because see what I did, I just did a good Socrates. I didn't do anything. I just did a good Socrates, and you will see I was able to rule out lots of differentials. 5 out of 10. Dull pain, no radiation. So usually what happened with appendicitis? Usually pain started in the umbilicus, then it goes to the right iliac fossa. But this patient said there is no radiation, there is no shifting. Can it be appendicitis? I would say less likely it to be appendicitis. Yeah. Kidney stone. Usually what kind of pain we have when we have kidney stone? Can I say it's from loin to groin? But this patient said pain is in the right iliac fossa. It started there, it's just there, no radiation. So unlikely to be kidney stone as well. Yeah. Yeah. Patient said 5 out of 10. Can it be ovarian torsion? I would say ovarian torsion pain is going to be very painful, isn't it? It's not going to be 5, 6. It's going to be maybe 10, isn't it? So it is also a bit question mark for me. Yeah. So LMP should have been asked. I'll ask. I know there are a lot of questions you want to ask. So what we are doing, we're just elaborating the presenting complaint. What I did, I just elaborated the presenting complaint, nothing else. And I was able to rule out many differentials. So you know what I am just trying to tell, what I want to convey, that how many differential I should rule out. That is the question that comes to me always. I would say you rule out, you just do a very good presenting complaint elaboration. You will rule out many things. Unknowingly, you will rule out many things. That's what we did. Now, the next question that I'll have would be, anything else? Do you have got anything else? Any other symptom that you have got? Anything else? Patient might say, yes, I've got vaginal discharge as well. Okay, then it makes my life easy. Vaginal discharge, tell me more about it. Now I will say, what is the color? What is the quantity? If it is a foul smelling, how much it is? I'll do that. Now with pain in the right iliac fossa, vaginal discharge, I'm having some differentials in my mind. And the most probable it's going towards STI PID. So what I'll do, I'll ask some associated symptom on the basis of it to confirm my diagnosis. So what I can ask about fever, I can ask about nausea, vomiting. I can ask about any ulceration in the private area if patient has got. So these are the questions I can ask, right? So my diagnosis is going more towards STI PID. Done. Now you want to confirm it, so you need to ask sexual history as well. Now I know sexual history somewhere in the later part of the station we ask. Where? I'll tell you in this where you should be asking sexual history. I'll come to this slide. So you ask later. Can I ask it here now when I'm elaborating or trying to make the diagnosis? Yes. Ask your sexual history so you can make the diagnosis as well. Right? That's what you did. Right. And now what you do, can it be ectopic? So I'll ask about LMP. Doctor, 2 weeks ago. So it's not looking ectopic pregnancy as well. You can ask some urinary related question as well, burning sensation or not. Yeah. And Crohn's, you can ask about diarrhea, constipation as well. Just one question. So to rule out the differential, honestly, how many questions specifically I asked? I asked only 2 to 3 questions only, and I ruled out maybe 7, 8 differentials, right? So this is what you are supposed to do in the exam. How many differentials? I can rule out so many without asking so many questions. That's what you do. So elaborate the presenting complaint nicely. You will see you will be in a better position. You have ruled out so many differentials without asking many questions. Yeah. Now, I have summarized everything in this one slide. Let's go through this slide and you will see a lot of things are covered. So if you get a patient, any presenting complaint, you start with, how can I help you? That's an open question. Doctor, I'm having pain. What you do? Tell me more about pain. Yeah, tell me more about pain. So elaborate the presenting complaint. First with the open questionnaire and then with the closed questionnaire, right? So you can elaborate by Socrates, by Odipara as well. Yeah. So you make sure you have completed your Socrates and Odipara. First with open question, whatever is left by doing close questionnaire, right? Then is there anything else? Then again you ask open question, is there anything else? Patient might say, I'm having cough. So what you do, elaborate the cough as well. That's what you do. Then based on your 1, 2, 3 symptoms, whatever this patient has given, you will have some differentials diagnosis with you. So you'll have some associated symptoms to confirm your diagnosis, and you rule out some differentials which you have not ruled out as of now. That is it. So this much, this is nothing much, just the 5 lines. It will make your life easy. In the exam, just remember 2 questions, my friend. Tell me more. Anything else? If you ask these questions, no, your life will be easy. If you don't ask these questions, you're making your life difficult. I would be very honest. Yeah. Do the examiner ask this question as well about the scenario? Not really. Not really. Not really. Right? Then what we go into past medical history, like a previous similar episode, medical illness, medication, allergies, hospital stay, surgery, family history, smoking, alcohol, diet, physical activity, stress, drugs, sexual history, travel, occupation, living condition, sometimes the driving status as well. Now, how many questions are there? If I count 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 18. So it's around 18, 19 questions we have got there. If I ask every single question, all 18, 19 questions, how long it's gonna take? So it is gonna take, I would say, maybe roughly 2 minutes of my time. In this, I've already spent 3, 4 minutes of my time, and if I spend 2 minutes here, it will be already 6 minutes. Do I have that much of time? Not really. So what I'm supposed to do? See, don't compromise here. This is a very important part of the station. So you need to spend time there. But when it comes to past medical history, personal, social, you have to be very quick. You're not supposed to ask all these 18, 19 questions. You're supposed to ask only 5, 6 questions. Which one? You will decide. I don't know. I can't tell you. So you need to see what kind of scenario you have got. I'll give you an example. If this patient is elderly patient having hemoptysis, blood and cough, losing weight. So my thinking, my mind is saying it might be cancer. So I got weight loss, appetite loss, all those things. So what I'm supposed to do here, what I'm supposed to do, I'll ask any previous similar episode. I can ask for any medical illness. I can ask for family history. I'll ask for smoking. I'll ask for occupation. How many questions? 4, 5 questions I asked, and it's enough. Now I know a lot of candidates, they say, no, I should be asking alcohol is important as well. Diet is important as well. Physical activity is important as well. See, I agree with you. And my answer to your question would be management is important as well. Right? So you have to be very careful. You cannot ask every single question if you are a human being. Yeah, so you have to be very quick in this part of the station. Take time here because you need to build the rapport, you need to ask question to make the diagnosis. But once you have the diagnosis, be quick with your past personal social history. Yeah, that's what you do. And in the end, you can ask, is there anything else that I should know? You've got a good rapport with the patient. Even if you're missing something, patient will be able to tell you. Yeah. Patient's concerns. If the patient has got any concerns, they'll be able to tell you, and you make sure you address it. Some of the concerns you can address it then and there. Some concerns which you can't address then and there, what do you do? Tell the patient, I can see this is your concern. I can see you are worried about cancer. Let me assess you first. I'll be in a better position to tell you in the end. And then in the end, you will be able to tell these things to the patient. Yeah. Impact of the illness on the patient's life. That's very important as well. See, I'm talking about if patient has got any chronic illness, right? If patient has got any chronic illness, so what you have to do, you need to ask the patient how it has impacted your life in general. Patient is having tiredness for the last 3 months. You need to ask how it has impacted your life in general, right? Because, oh, doctor, I used to help my kids as well in their homework, but now I just feel very tired. I can't just help them in anything, and it's really making me feel sad. So their mood and everything got impacted. So that is very important as well if it is a chronic problem. So this is your data gathering. This is your data gathering, this part. So this is your 4 marks. Now another 4 marks is your management. So this is your management. Let's come to this. Now what you do, you have to give the diagnosis. Before the diagnosis, you need to mention about examination. You need to mention about initial investigations as well, right? For example, a patient is telling us that doctor, I'm having a burning sensation while passing urine. I've got pain in the suprapubic area as well. Young female patient. What comes in your mind? Doctor, I'm going to the loo more often. I've got mild fever as well. I've got suprapubic pain as well. And sometime I feel I have to wake up in the night to pass urine as well. What comes in your mind? What is this history all about? Yes, you're absolutely right. All of you, it's UTI, right? I'm 90% sure it's UTI. So when you do the examination, mention, I would like to do your general physical examination. I would like to check your vitals as well. And I would like to do your tummy examination as well. When you mention this, what happens is sometimes examiner will give you the findings. Which investigation? These investigations which can be done very quickly as well. So which investigation? I would like to do routine blood, and I would like to do urine dipstick. That's it. So now the examiner gave you the finding that patient has got pain in the suprapubic area and patient has got leukocytes and nitrates positive in the urine dipstick. Now what is it? UTI. Now I've confirmed it as well. So before you give the diagnosis, what I want you to do is, I want you to mention about examination and investigation as well. And based on your history, based on your examination and initial investigation, you will give the management. You will give the diagnosis. That is what you need to do in all the stations. Yeah, easy. And you disclose and explain the diagnosis that it is UTI, then explain it as well. Explain the examination investigation as well. What I mean by that, the history that you have given me, Maria, you mentioned that you have got pain in this area, you're going to the loo more often, you have got fever as well. And yes, you're right. When we examined you, I found that there is pain in this particular area and your temperature is slightly high as well. And when we examined you, when we did the investigation of your urine, we found certain kinds of cells, which we say leukocytes and nitrates, they're high as well, which is suggestive of you might be having a condition called as urinary tract infection. So what I did, I disclosed the diagnosis, I justified my diagnosis, I explained positive examination and investigation findings as well. So this is something that you need to do, right? Now there is a very important term called as ICE. What is this ICE? So I is idea, C is concern, and E is expectation. This is the most important thing, guys, that you can do. Idea, concern, expectation. What is the patient idea about their problem? What are their concerns? And is there anything else they were expecting in this consultation? That is the main thing. Now, you might be thinking, patient has come to us, how the patient has got the idea, why I'm asking this question. It might not say, it may not be making much sense as well, isn't it? So let me clarify it for you. See, in this country, see, everybody is literate. I mean, they know English, yeah. They know how to use internet and all. So what happens is, if patient is having, say, blood and cough for last 1 week, Do you think they will not check on Google blood in cough? What is it? Will they not check it or will they check it? What do you think? I think they'll check. And what Google will say when you type blood in cough, I think the first thing it will say is cancer. So that is what I want to know. What is this patient's idea about their problem? What are their main concerns? Because many times when I'm suspecting cancer, I need to tell the patient that I'm suspecting cancer. And it's very difficult for me to say that we are suspecting cancer. So I won't say that directly. What I'll do, I'll ask the patient that you're having blood in cough. You're losing weight. You're not enjoying your food. You're feeling tired. So is there any idea? Do you have any idea what's going on with you? I'm not very sure, doctor. Are you concerned about anything in particular? Doctor, I'm concerned about cancer. And then your answer is, I can see you are concerned. It's a valid concern considering all these symptoms that you have got. So what you want to do, we want to do further investigation to rule out this main sinister thing, which is cancer. So that is how you will disclose the cancer or the tough diagnosis in front of the patient. Instead of saying you might be having cancer, no, get their idea, get their concern. That's what you do, right? What is this expectation? I mean, you might be thinking if I ask, what are you expecting today? No, that is not how you ask. Okay, so you're having you're having cough, pain, and this is your diagnosis. I'm going to treat you. But is there anything else you are expecting from this consultation? That's how you ask. Let me give you another example. I told you I'll give you an example. So your patient has got a headache and you took the history, ruled out all the red flags, and you understood that this is a tension headache. You understood that this is tension headache. And you gave the management, tension headache management is usually lifestyle advices. Like if patient is smoking, no smoking, patient is drinking alcohol, no alcohol, and patient diet is not good, you encourage the patient to have good diet. Patient is not physically active, you'll encourage the patient to be physically active as well. That's the management, isn't it? You did everything, and when you got the result, you got 1 in management out of 4. Why 1? I did everything. Why I got 1? Because you didn't fulfill the expectation of the patient. What was my expectation? My expectation was a CT scan. Did you talk about CT scan? No. But your comment is we don't do CT scan in a tension headache. I agree. But I wanted to have 1 as a patient. But you didn't tell me. You didn't ask me. So how it is done? I mean, most of the patients in the UK, you will see they have got a hidden agenda as well. It's you who need to get it out from the patient. So what you're going to do in the later part of the station, you ask the patient, okay, I mean, you ask the patient, is there anything else you were expecting from today's consultation? Yes, I understand you have got tension headache. I'm going to talk about the tension headache management, right? But during the management, I just want to know, is there anything else you're expecting today so I can keep that also in my management part? Then they might tell you, doctor, I'm expecting a CT scan as well. Then you can ask why CT scan, and then you can explain why CT scan is not a good option. So that's how it is done. So eyes is very important. Now, a lot of candidates ask me where I should do eyes. Should I do in the beginning, in the middle, in the end, before the diagnosis? Where? I would say do eyes wherever you want, but please do it. Can I do it in the beginning? Yes. Can I do it in the middle? Yes. Can I do I separately, C separately, E separately? Answer is yes, yes, yes. Can I do eyes more than once, twice, 3 times? Yes, yes, yes. Please do it. That is the only thing I would like to say. So if you do ICE, life will be easy. ICE is your bestest friend in the exam, and you cannot go without ICE in the exam. As simple as that. Right? That's what you do. Right. So that's your ICE. Yeah. Now somebody's asking, if we say GPE, GP actually covers a lot of things. It takes hours to do it. Do you think it's the correct way to use GPE? You know, doctor, why we are using GPE, general physical examination, I'll tell you. See, there are some examiners, when you say, I would like to do GPE, they might give you I would like to do the examination, and they will give you the findings. But some examiners, they may not give you the findings unless you specify the particular examination. So what I want you to say general physical examination and then specify as well which examination you're looking for. For example, when we did the UTI case, I said general physical, then I said vital, then I said abdominal examination as well, just to cover maximum things, right? Now, another question that you asked me, should I say vitals or should I break it down to blood pressure, heart rate, respiratory temperature, oxygen? That's absolutely okay. You can break it down. That's absolutely okay. Otherwise, I'll give you another smart way of doing things. I would say vitals is nothing wrong in it, but specify that vital which you are looking for. What I mean by that. In UTI, I think you are looking for temperature mainly. So you can say, I would like to do, I would like to check your vitals, including your temperature. So it means you gave the importance to the temperature. An examiner understood it. You're doing a station of thyroid. What is important in thyroid? I think to check the pulse rate, gradient tachycardia, isn't it? So what you say, I would like to do your vitals including your pulse rate. You got a station on postural hypotension. You want to do the blood pressure. I would like to do your vitals including your blood pressure in standing and lying down position. Do this way. That is much better. But yes, if you've got time, you would like to say blood pressure, heart rate, pulse rate, respiratory temperature, that is fine as well. But sometimes time is the problem in the exam. So you can use my approach as well. Both are fine. Nothing is wrong. Yep. So let's come back to this management parts. Examination, initial investigation, ICE, you can do wherever you want. Disclose and explain the diagnosis and explain the examination and investigation findings as well. Now, further investigation. If there is any station where you want to do further investigation, you can mention that as well. Further investigations would be if you want to do endoscopy, you want to do colonoscopy, you want to do MRI, CT, and all those things. So you can mention that thing here. So that is your further investigation you can mention. Then the treatment, you go for treatment as well. Symptomatic treatment and specific. Don't forget symptomatic treatment. This patient said, I'm in pain, so I'll give you some painkiller. I was having cough, I'll give you something for your cough. I was having nausea, vomiting, I'll give you something for nausea. Don't forget symptomatic treatment. I've seen a lot of patients, a lot of candidates, a lot of you take symptomatic treatment for granted. Don't do that. It's really important. Yeah. And then specific treatment, whatever the scenario is, you just do the specific treatment as well. Yeah. Now, the medical, non-medical doctors, tell me now, medical treatment first or non-medical treatment first? Tell me, medical or non-medical? Which one you will do first? Medical treatment first or non-medical first? Yes, it depends. I think you got the answer now. Yeah, it depends. I'll see the patient, I'll do accordingly. I'll do medical or non-medical, I'll see. Then you decide on the admission if you want to admit the patient or you want to discharge. If you want to admit, admit. If you want to discharge, discharge. And if you're not sure, keep the patient in observation and call the seniors as well, and they can decide, right? Follow-up and warning sign. I told you it is must. Your management will not be complete if you don't mention about follow-up and warning signs. Yeah. OT-PT reviews. OT is the occupational therapist. PT is your physiotherapist. OT is like they can make some changes in your house condition as well if needed, according to your medical condition, right? So they can do that. And if this patient need any physiotherapy appointment, you can mention that as well. So you'll see in a lot of patient files, it's written OTPT, OTPT, OTPT. So this is what you mean by OTPT review, right? And then warning signs that you can mention. And you can mention about the leaflets and the pamphlets as well. That's it. That's it. That's it. So this is your management and that's your data gathering. So this whole slide, it covers everything, to be honest. You just need to put things properly in this slide and all the history scenarios are covered with this slide on, right? That's how I teach. Make sense, guys? Yeah. Can we offer leaflet in every station? That's absolutely okay. You can definitely offer. There won't be any leaflet in the cubicle, but you can mention it to the patient that we will be giving you a leaflet. That's absolutely okay. And there are some information leaflets online as well. If you can't give in person, we do sometimes send the link to their mobile phone. They can read it. For example, you might be having a question that if I'm doing a teleconsultation, so should I how can I give leaflets? So in teleconsultation, still you can give leaflets. You can send a link of the leaflets to their mobile phone and they can read it. Yeah. So I'll do teleconsultation separately. Maybe in the next week or so, we'll have teleconsultation class separately. Right. So interpersonal skills. So you discussed about history. You discussed about management. What is interpersonal skills? Let's see. Medical first or non-medical first? Come on, doctor. We answered that question. Answer this question, everyone. Somebody asked this question. Medical management first or non-medical management first? What's the answer? Tell me in the chat box. Medical or non-medical first? It depends on the patient, doctor. It depends. If the patient is medically unstable, you will do medical management first. But if it is a counseling kind of station, then you go for non-medical management first, maybe. So it depends on case to case, right? So you can't generalize it. Yep. What is IPS? Interpersonal skills. How am I going to get 4 marks for my IPS? Active listening. Be a good listener. If patient is talking a lot, don't interrupt them. But Show them I'm listening to you. How you can do that? By noting your okay. Keep doing that. That is gonna show you that you're an active listener. Very important. Yeah. Body language. So the way you sit in the exam, don't be like very just sitting like this. Okay, tell me more about it. No, you have to be very active. Somehow show them these 8 minutes are dedicated to you. If you can prove that these 8 minutes are dedicated to you, you will pass the station. As simple as that. As simple as that. Right? Signposting. What do you mean by signposting? See, you are taking a history, medical history, then you're taking past medical history, and then you want to ask about lifestyle history, which includes, say, this smoking, alcohol. So my last question was, is there anyone in the family having any medical problem? No, doctor. Do you smoke? So it came all of a sudden. Patient might not be expecting this question. So sometimes what you can do, you can actually signpost it, meaning give the heads up to the patient that these questions are coming. I can say, now, Jacob, I'm going to ask you some questions about your lifestyle. It might be related to your case. Tell me, do you smoke? So I just give the heads up that lifestyle questions are coming. Now, John, I'm going to ask you about your personal sexual history because there's a lot of patients, when they have got these symptoms that you have, we usually ask sexual history because it might be related to your case as well. So tell me, are you sexually active? So what I did, I gave heads up to the patient and I just gave the relationship as well. That symptom that you came with, we usually ask these questions. So the patient will not feel awkward as well. So that is what I mean by signposting. Involve the patient in the management. So when you do the management, for example, don't say don't say more than 4 lines in one go. So when you're giving the management, say 2, 3, 4 lines and then pause. Pause. Let the patient ask you a question. If patient is not asking question, you ask the question to the patient. Are you with me? Are you getting me? Do you want me to repeat anything? If there is anything that you didn't understand, please don't hesitate to ask me again. I'll be more than happy to explain it to you. That's what you do. Involve the patient. Yeah. Summarizing that you're doing in the end, isn't it? When you're giving the diagnosis, you're justifying the diagnosis as well. So that's what I mean by that. Ice is your best test friend. You cannot go in the exam without ice. Use ice. It looks easy. When I say ice, you might be thinking, oh, it's easy to use. It's not that much easy. So what I want you to do is practice a bit more with this ice. Yeah. Check and check. So what does it mean? So you give us little information to the patient and then you check their understanding. You give them a little bit of information, then check their understanding if they've understood it or not. Check, 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 check. That's what you do. Respond to the cues. They'll have medical cues. Verbal cues. They'll have non-verbal cues as well. Please respond accordingly. Yeah. Somebody mentioned stock phrases. You're right. What are stock phrases? Stock phrases are learned phrases. Learned phrases. So, and it should not be in the exam. But see, we are new to this PLAB2. So, can I learn the phrases today and practice with those phrases for next 2-3 months? Would that be okay? I would say yes, that would be okay. For example, like I would be very honestly saying, in my country, when I used to work, I never used to say sorry to my patient. But here we do that. So should I learn that sorry, thank you, please? I need to learn that, isn't it? So, don't try something new in the exam. When you're preparing, what do you do? You simply learn the things today itself. Oh, I'm really sorry to hear about it. Thank you. Please, kindly. I can't even imagine what you've been through. I can see you are worried. I can see you are concerned. All these lines, these are learned phrases. But if you learn them today and practice with them for next 3 months, then these phrases are your phrases and it will come very naturally in your consultation. Because when you are learning something today and you apply it tomorrow, it looks very awkward. It looks very odd. It looks like you are trying to say this, but it's not coming naturally. But when you practice with them for next 2-3 months, you will feel very comfortable saying these lines and it comes very naturally. Oh, I can't even imagine what you've been through. I know it's been a very tough time for you and we are here to help you. So do those things now, right? I have a habit of repeating whatever the person just said to show I'm listening. Should I get rid of this? I would say yes. See, summarizing once, twice is not a big deal. But when you summarize all the time, what's going to happen? It takes a lot of your time. The problem is time in the end of at the end of the day, right? So I would say yes, get rid of it. Once or twice, if you are summarizing, you're repeating, it's not wrong. I'm not saying it's wrong. But if you do it too much, it can be a tricky part. Yeah. And in asking about alcohol, a personal question, drinking is accepted and common here. And asking about alcohol, a personal question. No, asking about smoking, alcohol, diet, it is not personal. What we say, it's not personal, it's lifestyle. That's what I said when I signposted that. Let me ask you some question about your lifestyle. It might be related to your case. Tell me, do you smoke? See, why I'm doing signposting. See, my question, the last question to you was, have you had any surgery before? No. Anybody in the family having any medical problem? No. Do you smoke? So patient wasn't expecting that do you smoke question all of a sudden it came. So just heads up that I'm gonna ask these questions. I expect these questions. That is the aim, right? Perfect. How many days before the exam should I attend the academy for Simmons and mocks and everything? I'll answer all those questions, doctor. PLAB2 important. Trust yourself. Trust your English. Trust yourself. Yeah, that's a very important thing. A lot of candidates, they come to us, I'm not good in English. Come on, have you passed your English exam, your OET and IELTS? If yes, I think that's why you're here, isn't it? Then please trust your language. But when you practice for 2 months, you will see that you have become very, very nice. I mean, you have become very nice and you feel like, yeah, it's really nicely coming. That is the main thing, right? So trust your language skills. Use small sentence. I know when you go for OET and IELTS exam, they say use complex sentences and all. I would say use small sentences. If you make grammatical mistake, who cares? As long as what you're saying I'm able to understand, you will get marks, right? Practice in front of the mirror. To be honest, it helped me. When I was practicing in front of the mirror, it helped me a lot. It helped me a lot. And I would advise you the same. Practice yourself. You may hate yourself. You may hate yourself in the first few days, but then you'll start loving. I promise. Yeah. Record your consultation. You are your best critique, I would say. Record your consultation and listen to it. When you're sleeping in the night, just play it. Listen to it. I answered it in this way. I could have answered it in this way. That would have been better. Oh, I interrupted the patient here. Oh, I didn't acknowledge it here. Oh, I could have showed more empathy here. So criticize yourself. That's very important. Be strong mentally. You have to be confident. Be confident, but don't be overconfident as well. I've seen some candidates when this is sorry, they're like, no, okay. A patient is saying, I'm in pain. Okay, I'm sorry. Tell me more about it. I mean, it is like I'm talking in an overconfidence way, or I'm talking in a way that I don't care. Don't do that in the exam, right? Reassurance, trust your language skills, and relaxed mind can do wonders, my friend. Can do wonders. So this is what you need to do. Yeah. Right. So that's what I've got for PLAB2 introduction. Right now. Let me have your questions. How many days before the exam? I would say, I mean, attend the course. When we do our course, so what happens is we tell the candidates to start preparing at least 3-4 months in advance. Attend the course once, maybe online, and then you can attend in person as well, and spend at least 4-6 weeks in the academy as well, where you can practice SimMan, examination mannequin, and you can give your marks as well. Yeah. Can you make a video about SimMan? There are lots of videos, doctor. On the Study Genie we have got, even on the if you check on our website, our YouTube channel, there are 2 videos, I think, but on the Study Genie, there are many. We have given it to you. Even we have performed the sim and recorded that 8 minute consultation. It's there on our website. Yes. Basically, just be a good person overall. Absolutely. Absolutely. 2 weeks before, is that good? I'll answer that. I'll answer that. So, first of all, what is there in our course? And I'll tell you if 2 weeks are okay or not. So if you want to spend only 2 weeks in the academy, what you should have done before that, that is what I'm going to discuss. First of all, this is what our full course includes. So when you book the course, you will be able to attend live in-person classes. Will you get these slides? Yes, we will be sharing these slides, no problem at all. Yeah. So in-person classes. See, I would say we are the only academy doing live in-person courses. If you go on any course, what they do, they have got the recorded videos and all, or they have a session, they have a session for a couple of hours only. We are the only academy. We are doing it 12 days in person where the physically tutor is there to teach you, right? So that is something that you need to do for this exam. And what we do in our live session, these 12 days, we practice with you. In our 12 days, you will see we will practice around 130 to 150 scenarios. In total, we have got, I think, around 400, 450 scenarios. You will see 131, half of the exam, we will be practicing in the course itself. So what I mean by that, you can attend it 2 times, you can attend 2 or 3 times, we don't mind what it means. So when you come to the academy, attend it in person with one batch, right? And you are like, no, I want to attend it again because few classes I wasn't very clear. I want to attend them again. Again, attend in the next batch. Attend it third time in the next batch. That's fine. You're most welcome to attend. That is what I mean by that. Sometimes what happens is you're like, I was able to attend only 6 classes in the first batch. Can I attend next 6 in the next batch? Of course, why not? Please. Yes. Now, what happened is all these live classes, they are live telecasted as well. They're live telecasted as well. Now, I'm answering the question of Dr. 2 weeks before, is that good or not? So, what I want you to do, to everyone actually, because you are from India, from Pakistan, from Sri Lanka, from Saudi Arabia, from Trinidad, from Nepal, they've got different countries you are in. So, what do? You attend our live telecast of these classes from your country, from Africa, yes. So, what I want you to do is attend the sessions from your country, online telecast of it. So what happens is when you attend the online telecast, you understand what this exam is all about. And what you do, you will be able to read the material as well that will be given it to you. And we have got pre-recorded videos as well. There are lots of academy, they just have pre-recorded videos and they're saying this is our course. Come on, pre-recorded videos cannot be the course. What is our course? Pre-recorded videos will give it to you. That's fine. That's a separate thing. You can see, for example, you're working and you've got 2 hours, 3 hours, you want to see them, see. It is going to be very helpful. But the main thing is the course, in-person live or the telecast, live telecast that you can attend from your houses. That's what you should do. So what I want you to do is, first, you attend it from your country. Attend it now, next batch maybe. Enroll into the next batch as soon as possible. Start your journey because you have done your PLAB1, you have to do PLAB2. So when I'm going to do it now. Do it as soon as possible. That's what I want you to do. So what you do is access to these live online classes as well, right? Attend it once, read the material, practice online with your friends. So when you come to the academy, you're fully prepared actually. And then maybe few classes, if you've got 2, 3 weeks only. Now answering your question, doctor, you've got only 2, 3 weeks. So maybe in those 2, 3 weeks, just practice in the academy. You're not coming to attend the course for those 2 weeks. You already attended it online. You have practiced with your friends as well. So when you're coming there for 2, 3 weeks, you may be able to attend 1, 2 classes, which is very important, like mannequin simman, and then practice with the colleagues, and then give mocks, attend simman maybe, and then go for an exam. So it is doable, but it's going to be tricky. Yeah. And we will be giving you comprehensive material books as well, and also the flashcards as well. So these are revision cards that will be given to you as well, right? And you'll be given the printed book as well. So we have got mocks as well, 2 full 16 station mocks. It's going to be like the exam. You'll have history, counseling, ethics, examination, mannequin, simman, prescription, everything in the mock. You'll enjoy it. Yeah. Mannequin practice, we are open 24/7, guys. 24/7. Those who are staying in our accommodation, they have the access of the mannequins 24/7. What else you need? Yeah. I know some of you are interested in learning in the late night. You are not a morning person. So no problem at all. Always welcome. Yeah. Simman practice that keeps on happening every week. Post-course support session. I'll discuss this post-course support in very much detail. Academy access 24/7, guys, 24/7. There's the only academy which is giving you 24/7 access. Support until you pass. We have got exclusive. Every batch we make a WhatsApp group as well, right? And practice with the faculty. So during the course, you will be practicing with the faculty. At least 130, 150 stations will be practiced. Yeah. How are you going to apply for the mocks, online or in person? Mocks are only and only in person. So when you come to the academy, I mean, you are going to come, some are going to come for 2 weeks, some are going to come for 3 weeks, 4 weeks, 5 weeks. So what's going to happen is we will be able to adjust your mocks accordingly. Yeah. I'm not added in the WhatsApp group batch. So what happens is whenever the batch is going to start, just 2 days before the batch starts, we add the people, right? That's the thing. Yeah. I texted on the link in the website as well. I didn't understand your question, Dr. Cal. What about the notes? Should we buy books before attending face-to-face classes? So the course include, when you book the course, the material is included in it. So what is going to happen? You will be able to access the material online. You can download the PDF and read it. You don't need to buy set separately. It is included in the package. But some of you want us to courier the books to you. You are not a person from the PDF. Then we can courier it to you as well. And then you have to pay for the courier charges. But to be honest, now we are giving you PDF. You don't need it, to be honest. Yeah. So you don't need to pay separately. It's included in it. Yeah. Now, what is included, I've explained. Now, what is this post-course support session? Which is very helpful because this is what feedback we got. So, okay, let me share something. This is our batch schedule. This is the batch we started on 16 and we finished it yesterday actually. So this is how we do in 12 days. First day, for example, on 16 December, what we did, we had an introduction and the medicine session. On 17th, we had counseling and again medicine, dermatology. On 18th, we had gynecology and pediatrics. On 19th, we had medicine and surgery. On 20th, we discussed ethics. On 21st, we discussed psychiatry and colleagues consultation. And 22nd, we discussed nothing because of study break after too much of session. Yeah. On 23rd, we discussed medicine, whatever topics were left. 24th and 25th, we discussed all the examinations. Right? On 26th, we discussed Simban and we practiced on Simban. And then on 26th, 27th, we had a session on prescription. So this is the schedule that we did in the last course actually. And that's what we do roughly in all the batches, right? Now, this is happening separately. It started on 16th, finished on 27th, right? Then the next batch is starting on 6th Jan. So this is how what happens. Once the course finishes, we have a gap of 1 week and then the next course is going to start. That's what happens, right? So now there is a post-course support session as well, which goes simultaneously with this. So, for example, those who are attending it in person, they can attend. But those who have exam next 1 week or 2 weeks, we don't usually recommend them to attend the whole course again. What we have for them? We have got these post-course support sessions. What happens, first of all, in post-course support sessions? There are teaching sessions separately in post-course, like teaching mannequin. So one day they'll be teaching mannequin class only in post-course support. Then we have got hands-on management. So what we do, we make 4 groups, small groups, maybe 6, 7 people in a group. So 24 people will take, we'll have 4 examiners, 4 different rooms, and you'll be spending, say, 1 hour in each room. And they will have 4 or 5 mannequins. So you practice on those 4 or 5 mannequins under the supervision of the instructor before 1 or 2 weeks before your exam. So what happens is before the exam, you feel like I'm fully prepared now because I've done that session under supervision as well of somebody, right? And this Simon practice, see, this Simon we did like say on 26, we did the Simon in the class. But then this Simon session is not like once only. Once and twice in a week, we have these Simon practice session in the post-course support as well. For example, your exam is next week. So we'll have a Simon session where we have the candidate, those who have examined next week. So we one by one, we call them on the stage and they practice the scenario with the instructor. That's what we do. Right? Then we have got the expert faculty guided prescription writing stations. Every week we have got prescription writing station as well. So what happened is we give them BNF. We give BNF to each candidate. We have got 50 BNFs. So we give BNF to each candidate. We make them sit, and then we give them the scenario and start the time, and they have to write the prescription in 7 minutes, 8 minutes, and then we check it, and then we do it again. So 2 prescription they're writing every week. So this is how you prepare for the exam, right? And we have got spam session as well. What is this spam? It's self-practice assessment mocks. So what happened in that? Now, when you come to the academy, so what happened is you initially feel like, I'm not able to find the friends to practice with this and that. So what happened is, what we facilitate, we make you guys sit in a room. Say, for example, you have got 30 candidates. 15 will sit in this row, 15 will sit in this row. Yeah. So, and then you will keep changing your position as well. So in 2 hours, you will see a practice 10, 15 station with 10 different people, 10 different doctors. So you feel like, yeah, I've got 10 friends as well. I was able to talk in English for 2 hours. I made 10 friends as well. And in these colleagues, you'll have our mock examiners also in it. So you might have practiced some station with our mock instructors as well. And then later we'll give you the feedback on that as well. So that is quite helpful as well, right? So that is something that you need to do. So for example, if you see on 23rd of December, we had hands-on mannequin session. We had this hands-on mannequin session. So on 23rd, we were having the class on medicine in the classroom, but in the other rooms, 4 rooms, we had this hands-on mannequin session going on as well. So if you feel like attending the medicine session, it's okay. But if you're like, my exam is next week, so attend this hands-on mannequin session. That's how it has been designed for you. And it was at 11 o'clock, so 11 till 3 o'clock we usually finish it. Then at 6 o'clock we had this spam session. On 24th we had like prescription writing session. Prescription, obviously it's happening here on 27th. You want to attend this as well. But in the evening we have got a session on prescription on 24th as well. So there are lots of, every week 2-3 sessions are happening if you see. 26th we had a teaching session. Obviously on 26th, if you can see, there's a Simban session here. You can attend that. But you can attend here the teaching session of mannequins as well. A lot of this happening. It's not like only in one place the teaching is happening. Teaching is happening there as well, there as well, there as well. What you want to do, you decide and do it, whatever you feel important for you. And then sim and practice session on 26th, and then spam again on 27th. So this is the last I'm sharing. This is we just did yesterday till because today is a Saturday and we make this schedule every Sunday and we post it on Monday. So from Monday we'll have this weekly schedule, right? So if you see, this is hands-on mannequin happening. Only 4, 5, 6 people will be there, and the instructor will be there, and then they are practicing. This is a sim session. Sorry, a prescription writing session is happening. Everybody is having their BNF and they're writing the prescription. And this is a teaching session. This is not a classroom, to be honest, but this is a teaching session happening in the practice area. That's post-course support. This is a spam session. They will be sitting in front of each other and doing this spam session. That's how it is done, right? So post-course basically means, let's say I attended my batch and then just before my exam, I can attend this post-course. Yes. You won't be left just like that, do whatever you want. No, we will be supervising you. Will the book be available in the package or we have to purchase it? You don't have to purchase separately. It's a part of the course. So when you book the course, you will be able to download the books and read it from there. No need to pay extra. I participated in the online course twice. I would be able to come and stay in the academy only for 2 days. That's too less, doctor. Will it possible for me to cover hands-on mannequin procedure and 2 mocks? Doctor, you tell me how and when. You are giving us 2 days. You want to do hands-on. You want to do prescription. You want to do seminar. You want to do mocks. It's not possible. I mean, practically it's not possible, isn't it? Because hands-on mannequin is going to happen once a week, isn't it? So on what day, which day you're coming, I don't know. And mocks, we're not having mocks daily. The mocks are happening on Tuesday and Thursday. That's the day. So you're giving us 2 days, we can't give you 2 mocks. As simple as that. I don't know. But at least give us 1 week so we can accommodate everything. 2 days, you can't do everything. But I mean, it's not possible. Yeah. Can I join online classes now and join academy after 6 months? Of course, that is what we want you to do. That's what we want you to do. So you're asking like how long my course validity expiring before my exam date. Don't worry. See, any application you use, so you need to put a time frame there, isn't it? Like it's going to be valid for 3 months, 6 months. So we have put a time of 4 months. That doesn't mean after 4 months your course is expired. No, just email us that this is my exam date. Could you please extend my course? We will do that. Within 24 hours, it will be done. Just email us to info@aspire2plab.com. Nothing you have to do. How long is course valid for? Till you pass, my friend. Right. Uh-huh. Thank you. How should I apply for online live classes? Is there a separate fee for online class? So yes, the fees is once only, no. So the fees, I'll tell you. Let me bring that fees part as well. So the fees is, this is the fee. So group of 5, if you are, you will get £149 off. Our course price is £649, £149 off. So you can get it in £500. If you are booking on your own, we are giving a discount of £120. But if you're booking a group of 5, this is £500. So Christmas, New Year sale is going on. £529 if you are on your own. And if it's a group of 5, £149 off, and you can book the course in £500. Right. The thing is, £649 is already discounted. Our course, if you see what is included in it, what is included in it? In person, online, comprehensive material, pre-recorded videos, mocks, mannequin practice, post-course. The course price that comes out to be, you won't believe, it comes out to be £1175 actually. And how much you can get it for? You can get it for £649, all discounted. But Christmas, New Year, 500, you can book this course, right? Nobody can give you better course and nobody has got this much of discount going on. And that's the only thing I can say, right? Obviously, I'll say my course is the best, which is, but definitely you can confirm with your friends as well, those who have joined us, right? That's the thing. What I can promise, when you come with us, you will not be left alone. There will be somebody to help you, to support you, to mentor you, to supervise you. That's the thing. So online course, £500 per person. It's online, it's in person as well, it's pre-recorded videos as well, it is 2 mocks as well, practice, post course, everything, £500. Yes. So if I somehow manage to stay for 3 days, including Tuesday, Wednesday, and Thursday, would it be possible for the mocks and practical studies? So doctor, just email us that and book the mocks for that particular Tuesday and Thursday. That can be done. And I'm not sure if, see, practice area is open. You can practice 24/7, no problem at all. But on that particular day, I don't know which session is going to happen. Is it going to be hands-on? Is it going to be SimMan? Is it going to be prescription? So whichever session is happening on those 3 dates, you can definitely attend. Yeah. Where is academy? We are in Blackpool, doctors. We are in Blackpool. The reason why we are in Blackpool, because the accommodation is cheaper in Blackpool, and we expect you to stay for a bit longer, for 3, 4, 5, 6 weeks. So that's why the pricing of the accommodation will be cheaper. So it's going to be easy for you to stay there, right? And how long is the course valid for? So I told you, no, till you pass, my friend, till you pass. Yeah, till you pass. That's the thing. And are you providing? Yes, we are providing accommodation as well. And the good things about accommodation. So if you book the course now and you book the accommodation for say more than 28 days plus, you will get 3 days free accommodation as well. You will get 3 days free, right? This is something that we have in the accommodation. And we actually, it's always advisable if you stay in Aspire accommodation only. There are some perks of staying in Aspire accommodation. First of all, number one, you'll have 24/7 access to the academy premises, the mannequin area. And if you're staying outside, you have to go from the academy at 7 o'clock. As simple as that. Number two, safety-wise, it's good to stay in the Aspire accommodation. And lots of candidates, those are booked outside, they got cheated, they got scammed as well. So just beware of it. Be very careful as well. How much per day we pay for accommodation? So the accommodation pricing is, doctor, starting from £18 per night till £30 per night. So it depends on what would you like to book. Can you show us how does the accommodation look like? If there's a video, there are lots of videos and photos, doctor, on the website. So we will share you the things. Don't worry. All of you will get a feedback email also from our side. We will put the feedback email. And also do one thing, come in the WhatsApp group. I'll share the links and all. It will be easy. Please, please. And yes, we have shared the website, doctor. Just check in the chat. Yeah, in the chat, this is our website, Ankil Aspire Lettings. That is our website. So you can check the rooms, what kind of room you want, and you can put your query accordingly. Yeah, come in this WhatsApp group. Come in this WhatsApp group, guys. So the link also we have shared for the WhatsApp group, and we'll also just scan this. So it's going to be very, very helpful. So what is going to happen, as I said, course, in person, live online telecast, recorded, mocks, post-course, everything. What else? I mean, I don't know what else we can add in it. And all is in £500 if you're a group of 5. Right. Now, one more thing, what is going to happen? Okay. When you book it in this time, you will get PLAB2 audiobook as well. That is £59, but you'll get free of cost. We'll give you PLAB2 audiobook as well. It's audiobook which includes lots of ethics and counseling station. It was recorded by me, and you can listen to it, and you'll see it's quite helpful as well. Plus, I'm a BLS instructor, and I can give you a BLS certificate. If you do our full course, what we will do, we will give you a BLS certificate, which is according to the RESIS guidelines, and which is worth around £20-25 if you book it somewhere. You definitely need it for your revalidation. You definitely need it when you're applying for the job. So there is no look around. I mean, you have to have it. So we will be able to give it as well. So, I mean, you have some around £80 of things we will be giving it to you extra if you book the course. ALS, I mean, ALS is not compulsory. It is a good to do ALS, but it is not like mandated to do ALS, but it is mandated to do BLS when you're applying for the jobs. Yeah. And this discount, guys, it's limited. It's going to be till 31st only. So you have to be very careful. You have got 28, 29, 30, 31. 4 days left, and just book it. That is what we can do. Right. And also, it's just only and only especially for you guys, those who have attended this course. I'm going to send you a discount coupon as well, where you don't need a group of 5. I'll just give you a discount coupon, which you will apply, and you will get £149 off straight away. You don't need even a group of 5. Fine. I can't go beyond this price 500 because then it's not feasible for us as well, providing we are giving a lot of things in it, live courses, online courses, recorded mocks, post course, there are many things. So what I'm going to do, if you come in the WhatsApp group maybe, or we're going to send you an email with a specific thing and specific code. If you just apply, you can book it. No need for group of 5 and just book it straight away. Will that make sense? But in the next 2 to 3 days, that's the thing. Yeah. So the code will be sent to you. We have got your email addresses in Zoom. We will download it. Those who have attended this session, I know only 7 candidates only attended this session. We will get those candidates. You'll get an email from our side with the code. Just book it. Yeah. If I'm taking the face-to-face class from March, when I can start my online live classes? Then in the next batch, starting from 6th of January. See, the schedule, the batch details, you can check. I'll show you. I've got the batch details as well. So these are our batches, doctors. So we are here now. 16 December till 27, we have finished. Next batch is 6th Jan. After that, 27 Jan. Then 17th Feb. So dates are there. You decide which one. I don't know. You decide. So if you want to do the live online, I mean, you want to do face-to-face in March. And when I should do online live, maybe in the next one from 6th Jan. Perfect. Yeah. And if you are like, no, I want to do it once more, do this one as well. I want to do once more, do this one as well. You decide, my friend. We are kind of very flexible in it, right? And again, I'm proudly, I'm saying we are the only academy doing live in-person classes, right? Any other courses, ask them when is their live classes, when there is 10, 12, 15 days classes going to start. Is it going to be in person or is it hybrid? Most of them, they're just running hybrid courses where they'll just play a recorded video. Come on, recorded video you can see in your houses as well. I'll give you the access for that as well, isn't it? But I'm talking about the live classes from the academy where instructors teaching and practicing with you. We are the only one doing it. And I'm saying it. How many hours per day? How many hours per day? It's like we start at 10, doctor. We finish around 5 o'clock with the break, lunch break, and also daily 6-7 hours of teaching will be done. Do you do NCA UKFPO program? Yes, we do that, doctor. We do that. Yes, if you are interested in that, we can definitely arrange it. We do that. This year we did, and next year also we're gonna do. So yes, if you come there, you are done with the PLAB2 course, we can give you a very good discount for our UKFPO NCA program as well. Yeah, my exam will be on 6th of March. I'm currently in the UK. My husband is in short leave, take care of the kids. How could I get to know which Tuesday and Thursday early? See, every Tuesday and Thursday we have the mock, right? And if you open the dashboard, doctor, you can book the mock on your own. There is nothing that you need to do. There's nothing. You just it will pop up like these dates are available. So you just book those Tuesday and Thursday, whichever you feel comfortable that you can come. You decide, no, right? And if there's any trouble, you're not able to find the particular Tuesday, Thursday you're looking for, you just email us. Just email us. Our email address is mocks for the mocks at aspire to plab.com. Just email on this. Yeah, that's it. Right. And please scan this code if there is any trouble. Will you provide books in online classes as well? See, yes. When you book the course, you will get the book. You'll get the book, isn't it? You can download it. As simple as that. Yeah. If you're attending online, you have the downloaded version. But if you come in person, you'll get this book as well. This is the printed version. But for this, you have to be in the academy. No, how can I send it to your house? I can send it if you pay the courier charges. That facility is also there if you would like to opt for it. But it's entirely up to you. Yeah. I plan to take my exam in June. Okay. When should I book the exam? Huh? I plan to take the exam in June. When should I book the exam? Should I start? Oh, I think for the course, I think you're talking. Should I start studying first and book the exam halfway, or should I book the exam now? You need 3 months. If we are in December, book in April, May, June, wherever you want to book, and start preparing from today. That's it. Yeah. Don't wait that I will book it later. No, book it now. Can the in-class and 2 mocks in 1 week? Can the in-person classes and 2 mocks in 1 week? How, doctor? You tell me how. I mean, see, our course is 12 days. How can you attend in person in 1 week? That's 12 days. So what you can do is attend it online live for 12 days. If you can't do in one batch, do it in 2-3 batches. And when you come to the academy, do post-course support sessions and then do 2 mocks in 1 week. I think that is the best thing that you can do, doctor, right? I cannot join the academy in person, but I can join your online classes. Perfect. Because I live in East London. Will the price be the same? Yes, price will be the same. Yeah, there's no difference in that. You attend in person, you attend online. It's £500 for the next 4 days, and then it's going to be 649 pounds, right? We'll send you the what do you say, the link as well. Please come in the WhatsApp group. We'll give you more information there, and we can send you a specific discount code as well. How many weeks we have to be there in the academy before exam? See, usually what I say, I know you're not gonna follow what I say, but I would say 6 weeks. 6 weeks. So in those 6 weeks, first 2 weeks you attend the course again, and then 4 weeks you just practice, 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 practice. That's what you need to do. Understand? Okay. Anything else? So Christmas, New Year sale is going on. Yeah. Scan this QR code, and we will. Yes, I'll share these slides. Don't worry. So the slide will be shared via email. Don't worry, and you'll get the discount coupon with the email as well, just in the next couple of hours. Yeah. Total time period for preparation, doctor. I mean, I would say roughly 2.5 to 3 months. Yeah, that's what I say. Yeah. How to start the preparation? First, book the course. Second, you plan to attend the nearest live online course. During the course, attend the course live and keep checking the material as well. Do that for 12 days. Then you understand about PLAB2, you understand a bit about it. You have got the pre-recorded videos as well. Then keep looking for the pre-recorded videos, read the material more, and keep practicing on daily basis. That's how you do. And then 6 weeks before, come to the academy, attend it again in person, practice with the tutor in the academy, and you are good to go. Then mocks and practice. When will be the next Zoom classes? It's gonna be Zoom classes. You mean 12 days course? It's on 6th of January, doctor. This is the schedule. Yeah, these are the batch dates. Can I form my own group? We are 15 members. Whom to ping for availing the discount? Okay, just come in the WhatsApp group. Do one thing. Come in the WhatsApp group, and we will be able to help you. Our admins are there, so you don't need to worry about that. We'll be able to facilitate that. No problem. Which academy you chose for your PLAB2? I did attend a common station in London that time, doctor. It was 7-8 years ago. Yes. Right. And these are online class schedule. Online class schedule, like for example, I'll share. This is this last batch we did, and it started 10 o'clock till 5 o'clock UK timings, right? So whichever country you are, so you have to adjust it accordingly, right? But this was the schedule in the last batch, for example. Can we do the procedures at any time on our own if you're in the academy? Of course. 24/7. If you're staying in our accommodation, 24/7, the academy mannequins are available for you to practice. Is there a pre-recorded video of today's class? Yes, we will be having. And don't worry, if you're in the WhatsApp group, we'll share you the recording as well. Yeah. Can we please get a package for online classes only? There is nothing like that, doctor, we have got, because online class, it's everything, isn't it? You attend it online, you attend in person, so it's everything, right? And then mocks and everything. So there's nothing specific we have got. To be honest, if you have attended the course, you definitely have to come to the academy to practice, and you have to attend the mocks before you go for the exam. Otherwise, you're not fully prepared, and we don't want that to happen, right? So that's why we have got this package. Yeah. Okay, I'm a full course subscriber since September. After enrolling, we noticed a small problem. Yeah, 120 days in the study genie. How I still haven't finished? No worries, doctor. I said, 120 days. We have to fix it, right? We have to put something. Either I put 90 days, 120 days. You have to put something because this is the requirement of the application. What you need to do before it get expired, maybe 10 days before, just email us saying this is my exam date. Can you extend it till my exam? That is it. Right? What is study hygiene? It is study genie, doctor, not study hygiene. Our application, we have got a web application, an Android application. The name of the application is the study genie. The study genie, right? That's how it is. Yeah. Are you GP practicing in the UK? No, doctor. I did my medicine training in the UK, and after that, we started Aspire. So it's been 7 years, and with Aspire. Yeah. How to take the subscription. So that's how, and when you book the course, your subscription will be active in the portal. Yeah. Can't find the Android app for Study Genie. It is the Study Genie, doctor. The Study Genie. Yeah. Is there a link? Please, yeah, you can find the Study Genie, or the web application works really nicely, actually. Yeah. Not available on iPhone. It is still working. iPhone is they are giving us trouble, and so very long time. iOS is not that easy, So our team is working. So doctor, it's a troublesome. Yeah, approval issues are there in iOS. So Android is there, and web application is there. So I think web application you won't have any trouble, right? You can open it in your mobile phone, your iPad, your laptop, no problem at all, right? So tell me now, how many of you are joining us in the next couple of days? Yeah, I'll be sending you the link and just join it. Yeah. Okay, okay. One, two, three. Yes. Poll, enable it. Okay, plus one. Good. Mm-hmm. Okay, okay. We got at least 6, 7 people saying they're gonna book it now. Good, good, good. Okay, good, good, good. Already joined. Very good. Right. That's good. That's good. Um, any other question? Can't find the study genie either. Just come in the WhatsApp group, doctor. We'll be able to help you out. We'll be sending you the link as well if there's any trouble in that, right? Web application, you can get it, but this one we will send. Already joined, that's good. Already joined, that's good. Plus one, that's good. So there are like, at least I think 10, 15 of you said they will be joining in next couple of days, yeah? Right, 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 right. Right, so just message in the WhatsApp group and our admin CJ, he will reply to you with the links and everything, no worries at all. And now the session, after finishing it, we'll be sending this PDF and the discount coupon, which you will be using is to join the course. And again, I'm saying, as I said, it's the only course in the entire UK who is giving 12 days live classes. Nobody else is doing, right? Okay, guys, so any question, anything that you have got? Thank you, and I hope you enjoyed this session, yeah, the introduction. And there are lots of interesting things gonna be in the 12 days course. I'm definitely sure you'll enjoy that 12 days course. We just finished it yesterday, and the candidates messaged us saying it was amazing, and they had fun. They had fun. They enjoyed it thoroughly. Right. You can share the WhatsApp link to your friends as well. Yeah, I mean, share this to your friends as well. They can join the WhatsApp group, and any questions you can ask in the WhatsApp group, we'll be able to answer. So no worries at all. Yeah. Right. So yeah, WhatsApp link is there in the chat box. Just get it and please add your friends as well. Yeah, and share this PDF to your friends as well. Yeah, I'll share it in the WhatsApp group and we will send it to you via email as well. Yeah. Perfect. So good to go. Yeah. All right. So any question, you can put it in the chat box or you can email us. You can ask us anywhere you want. And I hope you have joined our YouTube channel and you have joined our Instagram. Yeah, don't forget to join these two things. Yeah. YouTube will get all the videos for examination and everything. And Instagram also will get lots of clips. So we have got two Instagram channels. One is with my name, Dr.Ankurkarg, and the other one we have got Aspire to Education. You can join both. Email for inquiries. Email you can use. I'll give you the email where it is written. Let me write it for you, my friend. Any problem that you have got, you can email us to info@aspire to PLAB.com. Any problem with the mocks, doctors? Mocks@aspire to PLAB.com. Right. Okay. Just a sec. Let me show you our video as well. We have made a video. Just wait. I'll show you one video. Yeah. How can I do that? Just a sec. Hmm. Right. So I have the video and how I should screen it for you. iPhone via AirPlay. Just a sec. That's the video. I'm not sure. I think the audio is the problem, right? It's not coming, I think, nicely. We'll send you the link. So that's the academy, actually. This is the academy. It was with the voice, but then this is the practice area. And that's the mock. They're gonna go for the mock. That's how the mocks are happening. That's a lounge you can practice on your own. I know sound is not there, no worries. So I'll send you the link of this video. You can have a look. I know, like when I share it, it's not giving us the sound. Why? I don't know. Right, so it's on the beach. That's the thing. That's the good thing about. Yeah, it's IN Neck Hill. Yeah. All right. Good. Right. So yeah, I mean, so that's the academy in a short. But yeah, we couldn't. I don't know. I couldn't play the audio. I'll send the link maybe um, in the email, and also we'll be uploading it on the social media as well. So no worries about that. Yeah. Okay, so thank you so much, and please join the WhatsApp and share this with your friends as well, and you'll get the PDF for this one, and obviously you can you'll get the discount coupon as well. Book it as soon as possible and start preparing as soon as possible. No matter your exam is in April, May, June, July, start it as soon as possible. That's it. Yeah. All right, guys. So enjoy the rest of your day, enjoy the rest of your evening, and see you guys soon. Bye bye.